and we've got a very exciting episode here this morning, broadcasting out of Jackson, Wyoming, with the Shift Health and Nature webinar series. And we've got some folks that are starting to roll in. So what we always ask is that you go ahead and use the chat feature at the bottom of your screen to introduce yourself. Tell folks where you're coming from today, where you're watching from. Let us know the organization that you're working with if you can. And one of the things that we've really been wondering about is the sort of use that you're seeing on trails in this particular moment in time. So if you could let us know whether you're seeing outdoor recreation increase or decrease on trails around your community. Just use the chat feature for that as you introduce yourselves to your fellow participants in this morning's episode. My name is Christian Beckwith. I'm the Executive Director of Shift. We're a 501c3 nonprofit organization based in Jackson, Wyoming, that focuses on the advancement of nature as a social determinant of health. And our Health and Nature webinar series is designed to help elevate the conversations around the health benefits of time spent outside. And we do that by working with folks from our various stakeholder communities in outdoor rec, conservation, land management, and public health. And so today's episode is part of our land management chapter. The chapter fits in overall into the series as chapter 4. So we've already had 3 chapters, including ones on public health and conservation. And we'll have one more in the run-up to Shift, which we're holding, broadcasting virtually from here in Jackson in October, and that's on outdoor recreation. So stay tuned. You can find out about all the episodes by going to our website. Of course, as always, we'd like to thank our sponsors, the National Park Service and All Trails. I am broadcasting from Jackson, Wyoming. You can see right behind me, I'm standing out in the field right now, is Grand National Park. So the pointy thing in the top is the Grand Teton. And if you look to, I believe, the viewer's right, you'll see Cascade Canyon, a magnificent trail. Encourage you to pull out your All Trails app and go ahead and put it in there. All Trails is a great tool to allow you to explore trails like Cascade Canyon in our national parks around the country. And All Trails, if you're not familiar with it, is a database of trails that's curated by their more than 11 million users. We're very grateful to them and to the National Park Service for making this webinar series possible. So thank you, National Park Service. Thank you, All Trails, for your support of our work. And today's episode is focused on a project that we've been incubating since last year's Shift. So at Shift, in October of 2019, remember those wonderful days pre-COVID, we all gathered in Jackson, Wyoming. And one of the workshops that we were focused on was called the Quantification of the Averted Medical Costs of Outdoor Recreation. Probably could have come up with a better, snappier title than that. But it was a remarkably interesting collection of experts who had done something that we found to be remarkable. And that is, they had quantified the averted medical costs of outdoor recreation. And it was really a eureka moment, because we realized that if elected officials, if public health officials, et cetera, had the tools that they could use to indicate the cost savings of trails, of outdoor recreation in general, that they would have a far stronger way to argue for investments in outdoor recreation and trail systems. And the real catalyst for it was Eva Garcia, who was a 2018 emerging leader, and she was part of this workshop, and she brought to our attention an economic study that had been done by Dr. Henry Shelton Brown of 291 miles of what is called the Caracara Trail systems in Brownsville, Texas. And Dr. Brown, in his economic analysis, quantified the averted medical costs of those 291 miles of trails at $5.9 to $12.3 million. And we said, whoa, if we could figure out a way to make a tool like that available to the broader population, we could be making arguments for investments in trails around the country. So that was really exciting, because generating the economic information about the cost-benefit ratio of investments in trails and trail systems typically exceed the budgets of most elected officials, of most health departments. So what we started to work on was an idea to make this open source and available to anyone. And that's a project that we've been incubating since last year's Shift. We've been working on it with a few folks that are here with us today, including Attila Beliti. Attila is the outdoor recreation planner with the National Park Service Rivers, Trails, and Conservation Assistance Program. So he's been a key part of this project to date. We've also been joined by Torsha Bhattacharya. She's the Director of Research with the Rails to Trails Conservancy, and she is based out of, was it Alexandria in Virginia?
Yes.
I'm very glad to have her as part of this team. She does head up Rails to Trails Conservancy's data collection and analysis efforts, and she oversees a national effort to quantify the numerous benefits of trails to help make the case for trail building, increased walking and bicycling among all sections of society. Her research interests include exploring the relationship between built environment and health, national planning and policy for active transportation infrastructure, equity, and social justice issues in transportation planning. So welcome, Torsha. Thank you for joining us. We also have with us today Dr. Henry Shelton Brown, and he is Associate Professor of Management, Policy and Communication Health with the University of Texas School of Public Health. The focus of his research has been in three areas of health economics: health insurance, diabetes, and childhood obesity. In the area of the productivity costs of diabetes, he's included family history of diabetes, which is a proxy for genetic information, and econometric models of diabetes-related labor costs. So he's been a great ally to us in this project, and he's heading up the development of the tools calculator. Thank you for joining us here this morning, Shelton. And straight out of Brownsville, and proud of it, we've got Eva Garcia. And Eva is the project manager for the Rails to Trails Caracara Trails, which leverages active tourism and active transportation strategies to improve the health of the Brownsville, Texas region, while advancing regional economic development. And so prior to her work with RTC, she was the city planner in Brownsville, Texas, and has an extensive understanding of the use of land management tools for city planning purposes. So she's been a great ally in this project as well. So welcome you all, and thank you for joining us here this morning. I will switch over and we'll begin this morning's conversation with a series of questions for the panelists. And what we're very interested in doing is ensuring that our audience members today have an opportunity to weigh in with their questions as well. So once we're finished with our questions for the panelists that we've been discussing over the last couple of weeks, we're going to turn it over to you. Use the Q&A section at the bottom of your screen, and please enter any questions that you might have for our panelists today. So folks, welcome. Thanks for joining us here this morning. And Eva, we really wanted to start with you, and we just wanted to understand a little bit about the demographical realities of your community there in Brownsville, and specifically the sort of health disparities that the community is struggling with. Can you let us know a little bit more about your community?
Sure. So the City of Brownsville and Cameron County are, we call it on the border by the sea, right by the Gulf of Mexico and the US-Mexican border. So because of that, our population is about 90% Mexican American. We do have severe health disparities. 1 in 3 are diabetic, 80% are either overweight or obese. And I think the most shocking statistic is that we have the highest rate of amputations due to diabetes in the state, possibly the nation. I'm not 100% sure. So those health disparities are compounded by high rates of poverty. And so when you have a community that doesn't have the income and sometimes the education to really be privileged enough and have access to or know how to eat correctly, what to do, where to go as far as like visiting doctors, we have like 60% of our population is uninsured. You have a lot of people crossing, and I'm not sure what their documentation status might be. So that has really compounded the issues with really high health disparities in our community. We really looked at trails as a resource, as a tool, as an essential tool for combating the health issues we have. We are no longer able to treat the diseases. We are at a point where we want to do preventative health care. That's the only way that we can really see health improve in our community.
Thank you, Eva. And tell us a little bit about the Caracara Trails. How does this fit into your objective to try to treat the health disparities before they're disparities?
Right. So because all of these communities in Cameron County came together, we knew we had significant health disparities. We applied to come up with a plan to create a regional bicycle and pedestrian network to promote active transportation, which can be both affordable and accessible to our community. And so with that, the Caracara Trails was created, became a vision. It's over 400 miles of trails, including on-street, off-street, connecting public lands like our U.S. Fish and Wildlife Spaces, our National Park Service, Texas Parks and Wildlife. And so we really, the Katakana Trails became a tool for active transportation tourism. If you have a lot of poverty, how can you get more people to drop off money in the community so that we can elevate the poverty issues and get people out of poverty through there? So the Katakana Trails is a vision. It's predominantly not built yet. We are still building. And that's where this transportation, this health data really helps us in gaining funding for trail building. So we have about, I want to say 50 miles in the ground, which isn't much, but we still want to, we're funding, we have over 20 miles funded, or at least for preliminary engineering funded. And we're continuing to get resources and funding for the trail network that we hope to build.
Yeah, thank you so much. It's such an innovative project, and I believe last year it was a Shift Award winner. Just a way for us to honor the innovation and the impact that it's already been developing. We're really excited to see it roll out. And I just wanted to ask Shelton a little bit about what the economic analysis of those 291 miles of trails revealed. What can you tell us about that, Shelton?
Well, yes. So not to get too much into how I did it, but like I believe Eva said, that basically the people that lived near in the catchment area, we defined a catchment area around the trails that were being developed, were 22% more physically active. Okay, so we used METs. Okay, we looked at people who had met guidelines, which wasn't a whole lot of people. We excluded them, and we assumed that the medical costs, say averted due to increased physical activity due to the trails, okay, was proportional to the reduction in medical costs. Okay, and so the cost, it's been shown by Wu and others at $228 of extra to $476 extra dollars per year if you're not physically active. So we applied, okay, those two numbers will be reduced by 22% if you're in the catchment area versus not. And we applied that to the number of people that live in census blocks near the trails, again, excluding people who were meeting guidelines, a proportion that were meeting guidelines. So Christian said at the beginning of the webinar, basically that translated into between 5.9 to 12.3 million dollars in savings of averted medical costs due to the trails.
Excellent. Eva, we've been working a lot with somebody you know quite well, Dr. Rose Gowan, who's an OBGYN out of Brownsville, and also city commissioner, who's one of the champions of the Caracara Trails. And I'm just curious if you could help us understand how you and Dr. Gowan were able to use the results of Dr. Brown's research for the city of Brownsville in making those arguments for investments in the Caracara Trails.
Right. So as Dr. Brown mentioned, I think that we saw it as a huge argument point for our decision makers in the community, both on a local level and on a state level. So we often use the study and the impact. You know, we want to save our community, our region, $6 to $12 million a year. We want to keep that money in the pockets of our people to continue to live here and flourish. And so we've brought this study when we're trying to promote new policies, new legislation, and it might be something as simple as like allowing access on certain roads, or if you're a planner, nothing gets done without agreements. So if I wanted to partner with National Park Service and get a land use agreement or any other agency, then we can use this study and the data about the potential impact. So they may say, oh, well, we don't want to open up our land to this public and this trail and create this space. But we can say, well, this is the potential positive impact that it can make in our community, and they might lean more towards allowing that access on their land. Additionally, like I said, we're a low-income community. We don't have a ton of money coming out of the city to fund trails, which, if you work in a local government, it's always about the budget. So what we do is use that impact to leverage diverse funding sources. There may be a Texas Parks and Wildlife grant and that we apply for and say, it'll increase tourism by this much. This is the projection there. And if it's a health foundation, which we often do apply to, then we say this is the potential impact by creating this X many miles of trails. We can have this many people in the area that will be 22% more likely to increase their physical activity and create this kind of health impact. So we use it in different ways, but the data is it's always helpful to have that data, those impacts, those results readily available for any application, presentation that you're fighting to build trails for.
Mm-hmm. Excellent. And in the lead up to last year's shift, I was talking to Dr. Belinda Reininger with University of Texas School of Public Health, and she was talking about the diabetes rates in Texas overall, and then also the diabetes rates in the Brownsville area after the advent of the Caracara Trails. And those rates in Brownsville had gone down 1.3%. I'm curious, Torsha, you've been doing a lot of work on trails counters, and I would like to understand how trails counters would help establish the importance of the Caracara Trails to public health outcomes with issues related to diabetes.
Sure. So in the public health literature, it has been a long time understood that physical activity is very closely related with positive health outcomes. Now, physical activity from trails related to positive outcomes takes it one step further. So we are working to develop built environment that supports active transportation behavior all over. At Rails to Trails Conservancy, Caracara is one of our regional programs, the Caracara Trails. We have it in the Bay Area, in our Philadelphia footprint, in the Washington, D.C., Baltimore, Miami, and the circuit regions. It's spread out throughout the nation, where we are trying to develop networks of trails where they're interconnected. And what research tells us is that when people have safe access and easy access to trails, they tend to use trails a lot more. And Christian, with this pandemic, having people cooped up in their homes, not being able to access the outdoors as freely as before, what we are seeing in terms of the national counters is trail use in some places have shot up by more than 200%. And it has been consistently high. Year-to-year comparisons have showed that on an average, it's about 90% higher than what it was during this time. And we think that it's also going to lead to a sustained change in behavior. For us, I think that is a ray of hope, because the more people can get outside, engage in such active lifestyles, the better it will serve them in terms of health outcomes. So we are seeing this nationally in terms of our trail count data, that it has been up significantly.
Yeah, thank you. It's such a great argument for trails in this particular moment in time. And part of what we're trying to do with Shift in October is make sure that this opportunity that's being presented by this incredible surge in use surrounding COVID of these trails remains something that it becomes a central part of who we are as a people, getting outside more often for the sorts of mental health benefits in particular that accrue. Shelton, I'm just wondering, if you could tell us a little bit more about the Trails Calculator project and what we intended to do.
Sure. Are you gonna pull up the prototype? Yeah. So this is just a this is just kind of actually I saw that some of the people I was working with on the school-based physical activity are on the webinars. Amanda Walker, I think, joined. So this might look familiar to her, but basically if you figured out how to do this for Brownsville, you can use it within Brownsville. If you want to extend the trails, you could modify, use things in the literature to make it available to other people. So, I was thinking this is kind of what I would like to make is that, if you're in a small town, Brownsville, for a smaller town, it's not a tiny town, is lucky in that they've got the School of Public Health. Not every community's got that. Okay. And so if you're trying to make the case that you're going to add trails in, say, a park, what do? You have to find someone with the expertise to make a specific estimate for your community. Okay. Not everybody has access to, I'm not the only health economist, but there's, not everybody knows. So not everybody has a Rolodex that has a health economist on it. So basically what I was thinking is, basically what I would like to do is use what we've learned in Brownsville and add some things from the literature and make a general calculator that people can use. Then they can go to their, to the city and ask for funding, to build trails. If it's a park, they could ask maybe the state, other organizations. Okay, so this is, what this is sort of like a little thermometer. When you get in the red, it's bad. Okay, so basically this is it's a ratio, it's the cost per met. Okay, and it's been shown in the literature that if you can make an investment like a trail, okay, and you can get another met, in other words, like some physical activity from people using the trail, and you can get a met for 18 cents, okay, then it's cost effective. This says 1.2, that's for kids. So we could make a calculator for kids and for adults. But basically what you might do is you might say, okay, well, we've got a park, okay, where we've got an existing amount of trails. We're going to add, let's say, 5 miles, whatever. Okay, we're going to incur some costs. We need to clear some clearing. We've got some elevation. Okay, that's going to add to costs. Also might increase mets. Okay, we're going to look at the number of times people might use it, how many visitors you get per month. You could think of this as if it's a national park, how many people visit. Maybe those are increasing because of COVID-19. Okay, is it seasonal? Okay, and so in other words, does it shut down in the winter, whatever? Okay, how many people come on the weekends? This is just a partial list. I'm just trying to give you an idea. So people would plug in this and they could figure out what the cost per met is. So like I said, it's a ratio.
Sorry, Jonathan. What is, we have a question. What is MET stand for? What is MET?
Yeah, so basically it's and I also saw one of my, one of our alumni of the School of Public Health here, who is an epidemiologist that focuses on physical activity, could jump in if I get this slightly wrong. I'm an economist. But basically it's, if you're sitting, you're a 1. Okay, so if you're just doing nothing, so if you're walking for 20 minutes, you're basically at a 2. Okay, if you're running really fast, you might be 7, 8, 9. Okay, and you multiply that by the minutes that you operate, and that's your met minutes. Okay, so yeah, so it's basically right. So it's a multiplier of resting. Okay. And so if you get more mets, you're getting more physical activity. if you can produce a met for 18 cents or less, it's offset by averted medical costs. That's the idea. So if the dial, when you plug in the numbers, if the dial is way up here, okay, then it's not cost effective. See, that's the other thing that we want to produce, is we want people to be able to plug in and say, all right, well, maybe the 50-mile trail with 5 bridges and a tunnel isn't worth it, but if we did a little bit less, it is, okay, and so forth, okay. So basically that's what I was thinking, and I guess it's kind of like reminds me of you know, like Japanese manufacturing. I'm kind of trying to put myself out of business. Okay, make a general calculator so that, you know, we can have more information out there. People can use it in their community to advocate for more trails, okay, without needing to contact someone like me.
Excellent. Okay, thank you so much for helping with that, some of that background information. And Attila, you know, you've been involved with parks and trails and open space issues, both in New Mexico and the Southwest, for over 25 years. And your work has really focused on helping local communities improve and enhance parks and open space and trails and river corridors. And I'm just curious, given all your background, your experience in this with the National Park Service, where you feel the National Park Service is most likely to benefit from something like this, and why you've become such a core part of the project. Why is the National Park Service such a strong partner in this project?
The Park Service is interested, I think, from 3 different areas, Christian and participants. One is multiple use pathways that address community health goals are typically not included in our park planning and trail planning efforts at park unit level. So we're mostly internal focused. And I think this tool and the outcomes of this tool would enlighten park managers and park planners to think broader about how parks and our greenways can be potentially have public health outcomes. And the Palo Alto project here is a good example that could be a case study for other units. The multi-use pathway in Grand Teton is another example where I think that was had lots of questions and issues early about its validity and useful in the park, and I believe it became one of the most highly used amenities in the park for a period of time after that was developed. So we need more examples of how multi-use pathways connecting to parks or through parks can be good public health tools. The second one is our Healthy Parks, Healthy People program through their Office of Public Health. And they want to promote all parks as a health resource. And they want to bring about lasting change in America's lifestyle choices and the relationship with nature and the outdoors. And they've got some guiding principles, or we do, as our work takes place both within and beyond park boundaries. And that's with also the RTCA program. We seek to provide equitable access to open space and natural places. So taking what happens in a park beyond the park boundary, and a commitment to improving public health will be mirrored in our internal program. So what are we doing internally? And probably the most important, I think, is from where I come, is within the Rivers Trails Conservation Assistance Program, small cadre of folks across the country who are working in communities like all of yours, helping to establish parks and greenways from the coffee shop idea to something that's implementable. And as we go through our work, we're often convincing partners, hey, we need baseline data. Who's using the resources? Who's out there now? What's happening in your community? What are your health metrics? What are your health outcomes? Where are the disparities? What are your health determinants? What can we do? Can this trail project, open space greenway project help address some of your community health goals and health outcomes? So as we do that work, we're convincing leaders. And just last week I heard from community leaders that, well, how much is this going to cost us? I said, well, you have to spend some money if you want to improve your community, whether it's for visitors or your own residents. Nothing's free, and you've got to spend some money to do it. But if we can help them justify the expenses, we can go a lot further with, and this calculator tool can help do that. And it aligns well with the Parks, Trails, and Health workbook that we developed with CDC that earlier helped to bridge that idea that how do we get public health folks, health practitioners involved in trail planning? How do we bring these partners together? And this tool is also going to help bring those partners together because they're going to see the aha moment that this is going to help our diabetes program, is going to help our obesity program, whatever the health program is going on, we can make those connections through this tool.
Great. Torsha, a question for you. How do you envision a tool, the Trails Calculator, to be, how do you envision it being used by decision makers?
So we have worked in so many different communities, and different leaders want different things. For some, economic impact of trails work a lot. For others, environmental and health impact of their constituents. For others, transportation options. So it's not a one language that fits all. And we have seen specifically in communities that have, and unfortunately, it's all across America, that people have the obesity problem. People have problems that research has shown can be treated without medicine and less medicine and more physical activity or time outside. So all of these research that has been done so far points to the need for these kind of tools and calculators. And as the work that Shelton is doing, it's a case study based in Brownsville, and not everybody has the resources. And that's where I feel the value of a tool like this is that people can take it, input just minimum amount of information that almost everybody would have about their local trails, and boom, you can get the number and that needle is a very visual and easy way to show the decision makers that in 5 years, this trail would have paid for itself 3 times over. And then you have your healthy community to show for it. So this definitely resonates with a lot of policymakers, and very important and timely.
Thank you. And I see we've got some questions coming in. We encourage those. So if you do have a question, please do drop it into the Q&A function at the bottom of your screen. Eva, you know, one of the things that really blew my mind about the Caracara Trails was that it was not only a health tool, but it was also an economic tool. And I'm curious what you can tell us about your understandings of both uses through your experience with the Caracara Trails, both as a health tool and an economic tool.
So I actually of the mind that trails can really help us solve or at least address some issues. So for me, I started into this, I'm only in this work because I needed to bike to get places. So it started for me as a transportation tool. I want trails to get from point A to point B. And then after learning about the demographics, after learning about the health disparities, you know, experiencing it myself, I was the fittest, tannest, most toned I had ever been in my life when I was biking every day. So I knew that it improved my health when I was using the infrastructure that was being built by the community. So I think, yes, it's a health tool, but it's an essential tool. And on the economic side, I saved money as an individual. The money that I did have, it went to more local coffee shops or businesses. Maybe I bought, you know, a purse at a boutique or something that I could afford because I wasn't spending money on gas or on maintenance. And so that's a small example, an individual example of if we provided more access to trails for health, maybe they're saving money on medication they may no longer need. High blood pressure medication is a big one that I hear locally. Oh, I got off my high blood pressure medication. And I hear like, you cannot get off your high blood pressure medication. I'm not sure, but so you start seeing people saving money when they're using trails more. And so you can look at it as a health tool, but it's an economic tool. When you use a multiplier of individuals that are increasing their trail use, you're gonna see more individuals saving money. And then it's also an attraction. So as we build and connect, you know, Palo Alto National Historical Park to our U.S. Fish and Wildlife Bahia Grande unit, people are going to come and want to bike that. If we had a bicycle and pedestrian bridge over the causeway so that you could walk or bike across to get to South Padre Island, that would be a huge tourism draw. Individuals will want to come just to bike this or just to kayak a portion of our paddling trails. So it's also an equity tool in a low income community in rural areas. As you build more miles of trails, you can increase access that to individuals that would otherwise not have trails in their community or their area. So I think, you know, we're learning as a local regional area how to promote the tourism of our trails and our parks. Before, I think like, oh, come to Mexico, come to the beach. Now it's check out our birds, look at these native trees, check out our wildlife. And so I think I'm starting to see more and more of that happen. And as Torcia mentioned, the pandemic is really limiting people's access to spaces, and that mental health is more important now than ever. And so if, you know, we don't want to be in the same vehicle as other individuals, if we don't want to meet up inside of a restaurant with others, there's always those park and open spaces where you can feel safer just during the pandemic. And outside of the pandemic, a place to relax, a place to think, a place to breathe. And so I really do believe that it's a health tool, and we're seeing that in Brownsville, as you mentioned, with the reduction of diabetes, but also an economic tool. And now our local Convention and Visitors Bureau is promoting staycation. Enjoy Palo Alto, enjoy the Bahia Grande. So I think we're gonna see more and more of that in the years to come.
That's great. And Attila, can you tell us both how and why we're partnering with Palo Alto Battlefield National Historic Park on the project?
You're on mute. I think you're on mute.
There's three units to the Palo Alto Battlefield National Historic Park. I think 2 are federal and 1's a local unit. And as the Caracara Trails initiative moved forward, there's an idea for a battlefield extension trail that emerged. And this was to connect the city of Brownsville to the city of Los Fresnos that was north. Los Fresnos is probably one of more underserved communities. It's very rural, I believe mostly agricultural community. And access into Brownsville from that what meant traveling along a county road, high-speed county road, limited shoulder, limited access for any kind of active transportation. I believe the Caracara Trails folks and the Park Service folks are working together and saw an opportunity to use the western boundary of one of the battlefield units as a connector to Los Fresnos. So, and since this is part of the land management series, this showcased an opportunity where the parks saw this trail, not so much for public health, but saw as an opportunity to let more people see the battlefield, the natural landscape, the cultural landscape of the battlefield, while the trail folks saw it as a transportation corridor, active transportation health thing. So there was mutual benefit from all the partners to extend the trail. I think it's about a 2-mile trail, which is under construction now through the Park Service. So this is a good example of the Park Service entered a memorandum of understanding with the local community, the city of Brownsville, the city of Los Fresnos, that they would have to develop the trail, they have to patrol the trail, they've got to do some of the monitoring within the park that allowed this whole trail to happen. So where that moves us is my earlier comment about enlightening park managers, that if this shows successful here, that other units can see the opportunities that maybe we can have a trail along our boundary to connect another unit or another community to the park, or just a better connection, as we've heard through this conversation about if you have access to a park or green space, you're more likely to use it. So how can that happen? So this Brownsville example is great. The Park Service also would like to know, they know how many people are coming through, but like to know who's using it, how they're using it. So I think some of the trail counter data and follow-up surveys will help the park better understand who those users are, and they'll continue to be a strong partner with the Caracara Trails coalition alliance that's formed down there. And I think Eva and Shelton can also address that too, maybe how, as it rolls out, or how it gets used in the broader perspective.
So I'll just add, the historic Battlefield Trail is a great example of how we're using our history and the National Park Service brand, I guess, to brand our trail. Before the extension project, the Palo Alto National Historical Park only was accessible through trail to the city of Brownsville. Moving forward, it will become accessible to the city of Los Fresnos and those residents. And then even more forward, we're connecting it to the city of Port Isabel and the city of South Padre Island. So as we continue to build our trail network, we're offering more access to this one park. And as Attila mentioned, there's 3 sites, but 1 visitor center where they really collect that data and have sort of more of like the exhibits and interpretation tours that National Park Service is loved for. So we're trying to just really open up more access to the park, but in addition, it helps us increase economic tourism spending and physical activity for our residents.
Thank you. I want to get to some of the questions that are coming in, but Shelton, I wonder if you could just give us a real quick snapshot of where the project stands to date.
Well, I mean, at this point, we're, we have the data from Brownsville, but, we've applied for some grants so we can get people working on doing a lit review. Okay. And we're also sort of, it's going to be a little bit of a sculpture, I suppose, in that there's things we would like to have in the calculator, but may not exist in the literature. And I would say that the participants in the webinar maybe can help us out with that too, if you guys know of some data sources and things. But basically we're, trying to get some grant money so we can pay some RAs and start working and see what's possible. It should be interactive. Just because something seems like it should be important to me, maybe is not important to the users. And so, if any feedback would be great.
Thank you. And Attila, how are we doing on our grants to get this project into phase 2?
Well, we applied for a Connect Trails to Parks grant through the National Park Service, and we're successful in that grant, which will help us do a little bit of the initial phase 1 work of doing some lit review work and bringing the partners together. I think our bigger goal from our project team is to put together a really good proposal that go out some philanthropic funding down the line, but to have Shelton and Oregon State and others and the local folks really come up with a really good concept that we can go after larger funding at this point. So that's where we're at. I think we were not successful in the Challenge Car Share grant. I'm looking into that at this point, but we'll look at other opportunities. And I think I'll add that to Eva as this moves forward. I think development implementation might come from the Great America Outdoors Act that is, moving forward. I think that's going to be a good place for us to work with the state of Texas and their grant program to see parts of that move forward. But for our project, we have some funding. It's tentative. It's based on FY21 funding and whether or not there's a approved budget in October or in the springtime for that to move forward.
Yeah, thank you. So we are actively seeking some funding to help us move it from phase 1 to phase 2. If you're with an organization that is interested in being part of the project and you are loaded, come speak to us because we're really looking for partners on the project. We feel like it'll add so much value across the country. And there was a question that was interesting about the 1.3% drop in diabetes. And I just want to really quickly touch on that. And Eva, ask you how that 1.3% drop in the diabetic rate in the Brownsville area related to Texas overall.
Right. So the data that they're showing is from the School of Public Health, the UT School of Public Health. And we're building and changing the environment to help improve the health in our community, but they're also doing a lot of marketing campaign and other work programs. They have cromatoras in the community, which is how they collect a lot of this data. So again, Brownsville is seeing signs because of all this work in reduction of diabetes, but compared to the state overall, Texas is seeing more diabetes as increase. So they're seeing more and more individuals similar to America, becoming more overweight or obese and seeing more diabetes rates. So it's a huge, not that it's a huge difference, right? 1.3 sounds really small, but it's a big difference in the community to start seeing those rates go down, which has been the result of all of this work and programming of our region working together. And we have partners to thank, like National Park Service, like Shift, like Rails to Trails Conservancy, all the municipalities. We're really trying to work together to build something regional to see these changes happen on a regional level. So compared to the state's going up, Brownsville, Cameron County is seeing decreases, and that's something that we're really proud of.
That's so exciting. Yeah, thank you, Eva. We've got a question from Shanae Simon and asking about comparable programs or initiatives around the country. Is anyone familiar with anything akin to this that's currently under development? Torsha, I know you've been doing work on something that's related and aligned. Are you familiar with any other sort of projects like the Trails Calculator?
There is one, but it's not US specific. So the HEAT tool that some of you might be familiar with. But a few of the communities, again, are trying to develop their own cost savings calculator, trail cost savings. So in that, they're trying to do multiple benefits versus cost of trail. So it's not just health, but economy, environment, equity measures, which are mostly qualitative measures, not quantitative, and then jobs access to disadvantaged population, focusing on minorities. So all of these, they're trying to quantify the benefits and then put out a calculator to, again, making the case to policymakers that a trail is such a good investment, especially when you compare it dollar for dollar with a mile of highway or road investment, that it pays off so quickly and in so many different ways.
Yeah, and that's what's so exciting about the project is the opportunity to make it open to anyone.
Yeah.
Not a lot of communities have the resources to be able to go in and hire Shelton or his equivalent out there and have them do a very specific economic analysis for their locale. So by making this open source and accessible to anyone, we're hoping to be able to have some sort of national impact on the development of these trails. And Torsha, given your work over the years, would you say that these trails, the question is often, are they a nice to have or a need to have? And how would you respond to that?
So I think pre-pandemic, a lot of people had the idea that trails are just nice amenities. It's very nice to be able to have one. When I have the time, I can afford to go there and recreate on trails. But as people realized the value of outdoors, easy and safe outdoors, this concept or the perception of trails has changed. And at RTC, we recently conducted a nationwide survey about how perception of people pre and post COVID, and during COVID, and people overwhelmingly across racial and ethnic backgrounds, they overwhelmingly think that trails are must have. They're just like any other utilities that any communities should be planned around. They're not just for a specific income level or a specific ethnicity or race. It's a facility that everyone should have access to as a matter of right.
Mm-hmm. Sheldon, does the Trails Calculator have any capacity to quantify the averted medical costs in terms of mental health?
Well, it could be done. You know, you could also look at productivity costs, and I think Eva was mentioning tourism. So actually, you know, the cost per met, you know, is actually kind of a narrow estimate. It could be broader, but certainly, you know, I know that, for instance, if you, you know, it depend on the data that we could get, but the way that quality weights work, the quality adjusted life years, okay, if you have someone who is depressed, you know, and then, you know, they get treatment and, you know, their lives improve, you can get to something like 0.4 of a quality weight. Okay, and what that means is we're weighting the quality of your life up by 40%. Okay, so that's quite a bit. And so you could definitely do something like that. Actually, you know, it's just not, I guess what the first step would mainly be averted costs. But yeah, so, you know, like, so people will, let me be a little clear. So if people are saying they're stressed or they're depressed, the quality weight that we apply to a life year added in economics goes down. Okay, and so if there can be improvement through being outside, being in nature, walking, okay, then if that goes up, we can put a dollar amount of value on that and compare that to the cost of the trail. So it definitely could be done.
And the next webinar episode is actually with Dr. Ralph Buckley out of Australia, who was responsible for the study that came out in November of last year that quantified the mental health benefits of parks on a global basis at $6 trillion. So there are ways that are being developed to quantify that as well. Maybe Shelton will put that into phase 4 of the Trails Calculator project. I did see a good question from Creighton Wright, and it said, can you talk more about trail counters, findings, surprising data, and how this information was used to make a case for increasing health outcomes and trail funding? And I'm wondering if Eva and Torsia, you can speak to this as it relates to the Caracara Trails.
Eva can speak to the specific Caracara Trails. I can speak to nationwide trends. What we are seeing now is starting March, seemed that summer had arrived early. So the peak that we generally see in summer had started in March, and it is a sustained peak till now. And this the initial peak was about 200%, and over the week, an average of 80 to 90% increase of trail usage. Surprising things, what we learned was in Ohio, one of the trails that was the busiest trails saw the largest drop in usage. And that was because it was a commuting trail. And now people are not going to the office, they're at home. So all of the recreational trails or trails that are not attractions in general, just beside your neighborhood trails are seeing a lot more usage than those famous trails. So, and people are also trying to avoid famous trails because they know on the weekends more people will huddle there. So they're trying to find these hard to find no-name trails to go outside. But overall, it's a very positive trend nationally.
Mm-hmm. And we had a point from Diane Conradi about the Whitefish Legacy Partners. And so this is an initiative up in Montana that use trail counters to conduct economic analysis via Headwaters Economics. And I think with the development of the Bureau of Economic Analysis, OSHA satellite account, the outdoor recreation satellite account, we're seeing, particularly with a shift towards this year, that folks were very quick to talk about the economic benefit of outdoor recreation in general and programs and initiatives in particular. But what we're trying to do with the Trails Calculator project is to also be looking at those averted medical costs, because that is another part of the economic argument that we believe can and should be made as we're making arguments for these investments in green infrastructure. So we're very excited about the development of this project and Shelton's work as the foundation for it with the Caracara Trails and with the National Park Service and Rails to Trails Conservancy. As we're wrapping up here, folks, I'm just curious, what final points you would make about the value of this Trails Calculator project to the national landscape at this particular moment in time? And I know Brownsville obviously is at the epicenter of the COVID crisis, but why is it important now to develop something like this Trails Calculator project?
So I'll take that. I think for the tremendous interest of trail use now and new trails, people planning new trails, thinking about new trails, it's imperative that we continue to partner with public health community and health practitioners. And I think they're going to fund this infrastructure even more than the Legacy Act will one day. And I think we need to continue to show that, as Torsia said, it's essential infrastructure, and every community decision maker needs to know the value of trails, parks, greenways for their communities, whether it's land trails or paddle trails, and how this tool can, if it's easily accessible and low cost, we can get our project partners to test it, to use it, to make the case to decision makers that we need to invest in this stuff in our communities. And that can happen at from the local rural community, farm community, all the way up to the municipal, big municipalities across the country.
Thank you. Any other closing thoughts?
Just one thought. I think we're almost at a historical moment worldwide with these kind of restrictions that have never been seen. And just the fact that people are suddenly recognizing and engaging in positive behavior, it's good to grab this moment and translate this peak into a sustained change, which is normal times it would have been impossible to do. So we have got this natural experiment at hand. And trails are by nature a great equity tool. You make them accessible to all communities, make them safe and inviting for all different types of communities, and you have a winner. So I think this is the right time to do this thing.
Thank you, Torsia. Eva, what closing thoughts do you have for us here today?
Well, I mean, I feel like I've repeatedly said, for me, trails help us, across the board, from equity to economics to health. The Trails Calculator, I think, is there to help us, quantify the health. I think for me, what I want to do with the Trails Calculator is really have a more direct correlation between trails and health impacts. We know physical activity improves health, but how do trails themselves relate into that? So, I'm very interested to see this Trails Calculator further, be used here in Cameron County with the Katakana Trails network, but then also seeing how it differs in other areas and how the health impacts might differ in other areas. Here we have 100-degree weathers, or we're getting hurricanes. So, it's very different across the board. And I love looking at the national differences and similarities. And I'm looking forward to seeing those results.
Yeah, 56 degrees and raining here in Jackson, Wyoming. Shelton, in the last minute that we've got here, what are your closing thoughts?
Well, I would just say, I would like this to be interactive. I mean, I think that people tell us what would be useful, and we can maybe modify what we're doing. Okay, a little, if we can find the data. And I would like, I want to produce something that's useful, okay, to people, and also accurate. So we need feedback for that.
Thank you. Yeah, we do appreciate any sort of feedback that you could add. We also appreciate the four of you taking the time today, particularly.
Can I add one thing, Christian? Just that as I remembered, as I mentioned, the hurricanes, we're looking at using this trail network now for drainage improvements. So we're in a river delta, and that's another equity dollar, another equity piece, and economic piece is there's a lot of economic damage done. And so, how can trails be used for sustainable, resilient community development? That's just last thought.
Thank you, Eva. Keep breathing down there. All right, and thank you all for being part of this conversation here today and for working with us on the project. And thank you for joining us here this morning. We are recording these episodes. You can find them on our YouTube channel. We are also sharing the slide deck on Figshare for the research community, and you can always join us on Slack at Shift Nature Health. Our upcoming webinars include, as I mentioned, the mental health benefits of parks. So this is with Dr. Ralph Buckley out of Australia, who is responsible for the paper that quantified the mental health benefits of parks worldwide at $6 trillion, together with John Jarvis, who is National Park Service Director under President Obama, and Brenda Schmidt, who is the founder of Solera Health and currently the CEO of Coplex. That's August 11th from 3 to 4 p.m. to accommodate Ralph in Australia at 6 o'clock in the morning his time. And then on Tuesday, August 25th, we're doing the mental health benefits of outdoor recreation with Kristen Walter. And so she has been leading the randomized controlled trial on surf and hike therapy for veterans with PTSD and comorbidity. She will be joined by Chad Brown, who is the founder of Soul River Inc., and Elise Reiniger, who is with, Rylander, who is with Out There Adventures. So that's Tuesday, August 25th. And of course, we do have an entire program developed around the mental health benefits of time outside with a specific focus on equitable access. That is October 14th to the 16th. We're broadcasting it virtually from here in Jackson, Wyoming. You can learn more about that at www.shiftah.org. Stay safe and have fun outside if you can get there. And we'll see you as part of the next webinar. Thank you.